are forgotten in financial regulation. Hardworking Americans are the ones who pay the price every single time. We saw it during the Great Recession where so many Americans lost their homes and their jobs and their savings. Has Wall Street learned its lesson?
In some ways, no, and that's the point. We know that they're always going to be driven by pumping up profits and their own bonuses. And that's why we have to make sure that there's some basic rules that protect the entire economy from some of those excesses. It's pretty basic to me.
Thank you. Let me ask it a different way, a similar question. If you were replaced by someone that, in your mind, in my mind, doesn't have the guts to stand up to the big companies, the big banks that are fleecing the public, that end up resulting in what happened 15 years ago. What happens? I mean, should we trust Wall Street in that situation when Director Chopra's not there?
One of the things that I'm really glad the law puts in place is a ban on officials like me from going to sell ourselves to the companies we regulate. We should not have anyone leading regulatory agencies who's there to kiss up to those they're supposed to oversee. We need to make sure that they are enforcing the law and not looking the other way as people across the country are cheated.
Well, that revolving door is far too common in this country, as you know, and this government and this city, with members of Congress and with staff, committee staff, personal staff, agencies like yours. Let me shift to medical debt for a minute. We've had the credit rate. We did a couple things, several things, but two notably that I'm particularly proud of. We started a tradition here where we bring the bank CEOs, 6, 7, 8 of the largest CEOs of the largest banks regularly here to answer to hold them accountable. We also have done that with the credit rating companies, as you know. Understanding and focused on medical debt. Medical debt can happen to anyone. It doesn't matter if you do everything right. Anyone can get sick. Anyone can get in a car accident. It has nothing to do with your credit worthiness, or at least it shouldn't. People should not have to deal with damaged credit scores and harassment from debt collectors on top of massive medical bills and navigating a far too complicated healthcare system. So, Director, are medical bills generally accurate?
We have found systemic problems with the accuracy of medical bills, particularly ones that are reported on credit reports. There's problems with coding. There is a ping-ponging going on between the insurance company and the provider. Sometimes multiple copays or deductibles are being charged, and it is why those items tend to not be predictive of your performance on loans like credit cards and mortgages.
So assuming that, and you've proven that that's the case, what impact do inaccurate medical bills have on consumer credit scores?
Well, we've seen scores go down artificially, pushing up the price to borrow for a home, and in some cases blocking a person from maybe even getting an apartment or a job.
And one of the reasons I hear my colleagues and I see Wall Street fighting hard against your agency, and you're fighting for consumers, not corporate America, is as a result, has a lot to do with medical debt. So talk to us in the last minute or so about the rule which would erase the medical debt burden for millions of Americans in terms of credit scores.
Well, we've proposed a rule that would block the reporting of certain medical bills on credit reports to better protect health privacy. Our proposed rule also blocks creditors from securing loans with wheelchairs, prosthetic limbs, and other medical devices. We think that a lot of the rule has already been implemented voluntarily. The 3 big credit reporting conglomerates have already eliminated much of it, and states across the country have also banned it as well.
So why the opposition from my Republican colleagues to this rule, and from some of corporate America? Why do they think it's a bad idea?
Well, I don't want to paint with a broad brush, and many behind closed doors really support it. But I think that there is too many debt collectors who weaponize this data in order to coerce people into paying they do not owe. I do not know, and we have looked at every single concern, We want to protect our rural hospitals. We want to protect access to health care and credit. But we think this is a very wise path forward as we continue to look to finalize it.
Thank you, Senator Rounds. And before I recognize you, thank you for your work with Senator Smith on housing. I wish we could have convinced some others in the committee to move forward with a number of pieces of legislation that you did with people on our side that would have expanded the housing supply in rural America and elsewhere. So thank you, Senator Rounds.
Well,
recognize.
Thank you,